Welcome to today's video about morning diabetes signs. Imagine waking up one morning feeling unusually tired, maybe thirsty, or even a bit off. What if these everyday feelings were silent alarms your body is sending you? What if they were warning signs of something much bigger? Did you know that over 537 million adults worldwide are living with diabetes? That's 1 in 10 people, and the number is rising every single year. Many of them don't even know they have it until it's too late. Could you, or someone you love, be one of them? Do you wake up feeling drained no matter how much sleep you get? Ever notice sudden hunger pangs, blurry vision, or headaches first thing in the morning? These could be early signs of diabetes that many people ignore. Are you missing these clues? Don't worry, we've got you covered. In this video, we'll uncover the 9 most dangerous morning diabetes signs backed by the latest scientific research and show you how to stay ahead of this silent condition. Stick around, because what you learn today could save your life or someone else's. Please note, this content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a healthcare provider regarding any medical conditions or concerns. Alright, let's jump into the list of morning diabetes signs you need to know, starting with the first one. Morning hyperglycemia. High blood sugar levels in the morning can be a silent red flag for diabetes management. It often stems from the dawn phenomenon, where hormones like cortisol and growth hormone spike early in the morning, causing blood sugar to rise. Another factor could be the Somogyi effect, a rebound rise in glucose after a nighttime low. Both scenarios can lead to morning hyperglycemia, which, if ignored, can worsen diabetes complications over time. Research published in The Lancet Regional Health 2023 found that individuals experiencing regular morning hyperglycemia had a 30% higher risk of developing cardiovascular issues. Prolonged elevated glucose levels in the morning stress the blood vessels, increasing the chances of hypertension and heart disease. These complications develop silently, making early detection even more critical. For people with diabetes, these morning spikes may also indicate poor insulin sensitivity. When blood sugar levels remain high, the body struggles to use insulin effectively. This creates a cycle that can damage organs like the kidneys and eyes over time. Monitoring morning blood sugar can help spot trends and guide changes in medication or diet. A simple morning test could be your first step to better health. Next, number 2, fatigue or extreme tiredness. Waking up tired, even after a full night's sleep, can be a red flag for diabetes. High blood sugar interferes with your body's ability to use glucose for energy. Instead of fuel reaching your cells, it stays in the bloodstream. This creates an energy gap, leaving you feeling drained when you should feel refreshed. Hormonal changes during the night also play a big role. The body releases cortisol in the early morning to prepare you for the day. But for people with diabetes, this hormone can spike blood sugar levels, causing what's known as the dawn phenomenon. Research published in Practical Diabetes 2020 found that up to 50% of people with type 2 diabetes experience this, leading to morning exhaustion. Chronic fatigue impacts your entire day. Tasks feel harder, and focusing becomes a struggle. Even more concerning, untreated fatigue can point to complications like insulin resistance or poor glucose control. If you notice this daily tiredness, check your blood sugar levels and share your concerns with a doctor. It's not just about feeling tired, it's your body signaling that something's off. Listening to those signs early can help prevent bigger health issues. Next, number 3, dry mouth. High blood sugar levels can pull water from your tissues, leaving your mouth dry when you wake up. This isn't just an annoyance. It could signal that diabetes is out of control. Persistent dry mouth increases the risk of tooth decay, gum disease, and infections like thrush. These issues often develop faster in people with diabetes, as high glucose levels weaken the immune system and slow healing. One major study published in the International Healthcare Research Journal in 2020 highlights this link. Researchers found that 57% of participants with poorly managed diabetes experienced severe morning dry mouth. The condition was also strongly associated with dehydration due to frequent nighttime urination. These combined effects can worsen blood sugar control, creating a vicious cycle. Pay attention if you notice your mouth feels unusually dry when you wake up. It could mean your blood sugar has been too high overnight or that your body is struggling with insulin resistance. Staying hydrated, practicing good oral hygiene, and discussing this symptom with your doctor can prevent long-term complications. Addressing dry mouth isn't just about comfort, it's about protecting your overall health. Next, number 4. Blurry vision in the morning. When your blood sugar is too high, it can cause fluid changes in the body, including in your eyes. These fluctuations may affect the lens of your eye, causing it to swell or shrink. This can make your vision blurry, especially in the morning after your blood sugar has been uncontrolled overnight. If this happens regularly, it could signal undiagnosed or poorly managed diabetes. Research from the Investigative Ophthalmology and Visual Science, 2023, highlights that hyperglycemia alters the osmotic pressure in the eye. This leads to temporary changes in the lens's shape, directly impacting how light is focused. The study observed that nearly 68% of individuals with early-stage diabetes reported vision changes before their diagnosis, making this a common but under-recognized symptom. Ignoring blurry vision could mean missing an early opportunity to manage blood sugar levels. Over time, high glucose can damage the retina, leading to diabetic retinopathy, which is a leading cause of blindness worldwide. If you notice the symptom, it's crucial to monitor your blood sugar and consult a healthcare provider. Early intervention can prevent long-term complications and preserve your vision. Next, number 5. Numbness or tingling in hands-feet. Nerve issues can be one of the first signs that diabetes isn't well managed. Waking up with tingling or numbness in your hands or feet could point to diabetic neuropathy. This condition happens when high blood sugar damages the tiny blood vessels that supply your nerves. Over time, the lack of proper blood flow makes nerves less effective, leading to those strange sensations. A recent study published in the Nature Reviews Disease Primers, 2019, highlighted that nearly 50% of people with type 2 diabetes will develop some form of neuropathy. The research also revealed that symptoms often start mild, like morning numbness, and gradually worsen if blood sugar levels stay uncontrolled. The study emphasized how early detection and tighter glucose management could slow down nerve damage significantly. These morning symptoms aren't just uncomfortable, they can lead to more serious issues. For example, numb feet may prevent you from feeling cuts or blisters, increasing the risk of infections or ulcers. In severe cases, this could lead to complications like foot ulcers or even amputations. Paying attention to these signs and seeking medical advice early can make a huge difference in avoiding long-term problems. Next, number 6. Morning headaches. Headaches in the morning can sometimes be a red flag for poor blood sugar control in diabetes. This happens because blood sugar fluctuations, whether too high or too low during the night, can disrupt your body's balance. For example, low blood sugar, hypoglycemia, during sleep may trigger your body to release stress hormones like cortisol and adrenaline to compensate. This rebound effect, called the Somogyi phenomenon, can result in high blood sugar by morning and cause a pounding headache. High blood sugar, or hyperglycemia, can also contribute. When glucose levels rise, it can lead to dehydration, which reduces the brain's hydration and increases blood vessel tension, triggering headaches. Studies show dehydration from hyperglycemia significantly worsens headache severity. A study published in the Genes 2022 highlighted that 28% of people with diabetes reported frequent morning headaches linked to overnight glucose dysregulation. The researchers emphasized that people experiencing recurring headaches should check their glucose levels, especially before bedtime, as this might help uncover patterns causing the issue. Addressing these headaches isn't just about comfort, it's about preventing further complications. By recognizing the link to diabetes management, you can take meaningful steps like better blood sugar monitoring or speaking with your doctor about adjusting your treatment plan. Next, number 7, brain fog. Waking up with a cloudy mind and struggling to focus could be a warning sign of diabetes. Blood sugar imbalances directly impact brain function. When glucose levels spike or drop, it disrupts the brain's ability to process information efficiently. This can leave you feeling mentally sluggish or confused, particularly in the mornings after an overnight fast. Research published in Neurobiology of Aging, 2020, highlights that chronic hyperglycemia affects the hippocampus, the part of the brain responsible for memory and learning. The study found that individuals with poorly managed diabetes had a 20% higher risk of cognitive decline compared to those with stable glucose levels. This isn't just a temporary issue. Persistent brain fog could indicate long-term damage if blood sugar levels remain uncontrolled. Low blood sugar or hypoglycemia is another factor. If your glucose levels drop too low during the night, the brain is deprived of its primary energy source. This can lead to confusion, memory lapses, and difficulty concentrating when you wake up. Many people dismiss these symptoms as simple tiredness, but they could signal a need for better glucose monitoring and management. If you notice these signs regularly, it's important to take them seriously. Track your blood sugar levels and consult a healthcare professional to ensure your brain stays sharp and healthy. Next, number 8, nausea. Waking up feeling queasy isn't just unpleasant. It can be a sign of serious blood sugar imbalances. High glucose levels often cause dehydration, which slows down stomach emptying. This condition, called gastroparesis, is common in poorly managed diabetes and can lead to nausea. When the stomach can't digest food properly, it triggers discomfort and unease, particularly in the morning after fasting overnight. A more alarming cause of morning nausea is diabetic ketoacidosis, or DKA. This occurs when the body burns fat for energy due to insufficient insulin, releasing acids called ketones. If ketones build up in the blood, it can lead to nausea, vomiting, and even life-threatening complications. A study published in Diabetologia 2024 found that nearly 40% of patients hospitalized for DKA reported nausea as an early warning symptom. Ignoring persistent morning nausea could mean overlooking dangerously high blood sugar or insulin deficiencies. For people with diabetes, checking ketone levels during episodes of nausea can help catch problems early. Always take morning nausea seriously and discuss it with your doctor. It could save you from a health crisis. Next, number 9, unusual morning hunger. Morning hunger that feels unusually intense can hint at blood sugar instability during the night, which may be a sign of diabetes or poor blood sugar management. This can happen if blood sugar drops too low or hypoglycemia while you sleep. Your body reacts by releasing hormones like glucagon and cortisol to raise blood sugar back up. This rebound effect, called the Somagai effect, often leaves you waking up starving. Research published in the Journal of Clinical Medicine 2023 highlights that overnight hypoglycemia can trigger excessive hunger signals in the morning due to disruptions in the hypothalamus, the part of the brain that controls hunger and energy balance. The study found that 30% of individuals with type 2 diabetes reported intense morning hunger linked to poor glycemic control. When this happens frequently, it could mean your current diabetes treatment plan isn't working well. High or low sugar swings can lead to long-term complications, including nerve and organ damage. Ignoring these signs could delay diagnosis or worsen existing diabetes. If you notice persistent, intense hunger on waking, it's worth discussing this with your healthcare provider. Simple steps, like monitoring blood sugar levels overnight or adjusting your meal timings, may help regain control. Your morning hunger could be a critical clue to better managing your health. Now you know the 9 dangerous morning diabetes signs and how they could be your body's way of saying, pay attention. Remember, awareness is your first line of defense against diabetes. By spotting these signs early, you can take control, make informed decisions, and protect your health. If you've noticed any of these signs in yourself or a loved one, don't wait. Talk to your doctor, monitor your blood sugar, and take those first steps toward better health. Thanks for watching. If you found this video helpful, give it a thumbs up and share it to help others. Don't forget to subscribe for more health tips that empower you to live your best life. Stay healthy and see you next time.